Dr. Dave here with Synergy Wellness, Chiropractic and Physical Therapy in New York City. Today we're going to talk about how to use a TENS unit. Now, this particular machine is called the Intensity Twin Stim 3. The reason why it's called that is it's got more than just TENS. This is a TENS unit and an EMS machine. On another YouTube video, we're going to go over how to use an EMS machine. But today, this video is about how to use a TENS unit and why would you want to use a TENS unit. What sort of injury would you use a TENS unit for? Well, let's go over that right now. TENS is for pain. With a TENS unit, you're tricking the brain into thinking you don't have pain. You're using the same nerve pathways. When you have pain in your elbow or your knee, it sends signals back up to the brain, perceiving that as pain. What TENS does is by providing stimulation, nerve stimulation at the periphery nerves, the nerves more on the surface, it can be very helpful for pre-surgery, post-surgery, if you're getting over some sort of soft tissue injury, but it's mainly used just for pain, okay? We're not using it for muscle stimulation or anything like that. That's more for an EMS machine. So let's go into the Intensity Twin Stim 3. Okay, it comes with this nice case, comes with a battery. It has a lithium ion battery in it, so you can charge it up and take it with you to go. I have left this on overnight, forgot to turn it off with the battery in it, and it will run through the battery overnight if you forget to shut it off. It will not shut off on its own. But this is a great unit. We're going to go ahead and put the battery in. This is a brand new unit. We're just opening up. Comes with electrodes, alcohol wipes. It's important to clean your skin off before you do this. The cleaner the skin, the more use you'll get out of these reusable, flexible electrodes. And you can buy these anywhere. They're not too expensive, but you'll get about 6 or 7 uses out of these if you clean your skin off with a little alcohol prep wherever you're going to place it. Okay, now that we have the battery in, I'm going to show you the screen here, okay? And if you'll see, we're going to go ahead and press the power button there and turn it on. Okay, now this unit comes with, as I said, a charger right here, but it has 2 channels. So one channel with 2 leads off of it, and the second channel with 2 leads off of it. So you can treat a large area like the back or the shoulder or the knee. Those joints I consider to be larger than, say, somebody with lateral epicondylitis, tennis elbow, or a golfer's elbow on the inside of the elbow. Unless it's a specific injury, like a specific source of pain, like if your lower back is bothering you and it's just right there in that lower right side or lower left side, it's in that one small area, then you could certainly use just one channel. And if you do that, you can unplug the other channel if you're not using it. So we're going to plug in both channels here, and these wires can get tangled up, so I'm going to keep them tied up right out of the package here. And you can buy all sizes. These are small. These are about 2-inch electrodes. If you're doing a real small area, you might want to get a little bit of a smaller electrode, but I like this. This size fits just about any area. And again, with TENS unit, you're tricking the brain thinking you don't have pain anymore. So when you put this on, you don't want to see your muscle contracting over and over and over again. You don't want to see that. You can see, if you're thin-skinned, you can see maybe a little bit of light contraction on the surface there. That's okay, but you really don't want the muscle to contract. That's for the EMS, not for TENS, okay? Again, TENS stimulates the nerves on the surface. That's why a lot of soft tissue works really well when you go to a chiropractor or physical therapist. They do a lot of trigger point therapy and soft tissue Graston and ART. A lot of the soft tissue techniques work really well to alleviate pain because a lot of the nerves are on the surface, near the surface of the skin, and that's where the TENS unit works. TENS stands for Transcutaneous Electric Nerve Stimulation. Now, we've got 2 electrodes hooked up here. So what we're going to do is we're going to hook it up to my elbow, a small area, just to show you. Let's say I have lateral epicondylitis, which we see a lot more people working from home on laptops, bad ergonomics. They're also on their phones with their thumbs, twittering away. So let's say I have lateral epicondylitis. We're going to unplug the second channel, and I think this unit just shut off on its own. So I may be wrong. They may have upgraded it a little bit, and maybe it does shut off while it's on the battery. We'll test it. But so if I have lateral epicondylitis, I may put the first electrode here and the second one right up there. So that's kind of where my pain is, right in the middle. Okay? And what we did is we created a cheat sheet for you, and I'm gonna put this cheat sheet up, and I'm gonna show you here, but it shows you not only pad placement, pulse width, and pulse rate. So let's talk about that. Let's talk about pulse width and pulse rate. First off, pulse width is the length of the electric stimulation, the width of it, the length of it, right? So pulse rate is the rate at which you're getting that stimulation. Typically, the higher the pulse rate, the more soothing. It's more comfortable to the patient. The lower the pulse rate is typically a little bit more uncomfortable. So that's a good note when we're setting this up. A lot of TENS units have settings already where it's preset to back, neck, shoulder, and it might have like a little icon like a neck or a back or something on it. This one does not do that. I like that better. This one, with our cheat sheet, which tells you which range of pulse width and pulse rate to use, this is more of a real sort of style TENS unit rather than those pre-programmed ones. I'm not saying the pre-programmed ones are bad, but I just prefer to use this. So as you can see here, there's a TENS screen and an EMS screen, and to flip through you would use the select button. And as you can see here, there's a button. It says M and S. So if you click the M button, you'll toggle through from TENS unit to EMS. Okay, and then underneath TENS unit, you'll see a B, an N, an M. Those are just different modes. Really, they all work. All the modes, just based on preference, really. Do what's most comfortable to you. I usually put it on N for normal, but a burst, B for burst, you'll feel a burst of impulses. Again, do what's most comfortable for you, but for starters, I'd say M. So to go and switch the mode, you can see the mode is blinking, the B is blinking. You just toggle through that to pick and select N, or normal mode. Then you get down to the clock, which will be blinking, and that clock right there is the timer. So with the timer, you can adjust it up and down here with the selector. So we're going to use channel 1. I don't have it plugged in right now, but and as you can see, I've got it to 33 minutes. You don't need to do it for 33 minutes. I would say on average, max would be 30 minutes. 15 to 30 minutes, even 10 minutes to 30 minutes is helpful, okay? Then we're gonna go ahead and hit the S button. Once we set the timer, it's set at 30 minutes. We select that. Now you'll see a PW there. PW stands for pulse width. So let's talk about that. Right now, this pulse width is set at 150. So it really just depends on the injury and where the pads are located as to what sort of pulse width works optimally. So again, I put that information in the description. And we're gonna go ahead and toggle to pulse rate. So you'll see down here on this side, the PR, it's small, but it's blinking. And that PR is the pulse rate. And this is helpful because again, the higher the number, the more comfortable typically for the patient. So you can mess with that. And again, we put the ranges for every type of injury and you'll see the pulse rate range could be anywhere from 4 to 90. It could be a wide range. So while you have the machine on, you can actually adjust it while it's on and see what's most comfortable for you. Again, you don't want the muscle contracting. You might see a little bit on the skin surface moving a little bit, but you don't want the whole muscle to contract. We have it set the pulse rate, you can see it blinking there, at 10. So we're gonna go ahead and save that. And now it's ready to go. So we just go ahead and plug in channel 1 because that's all we're using. Again, this is a smaller joint, the elbow joint, so we can get away with using one pad. But we had a patient in here recently that had bilateral, had a tennis elbow and golfer's elbow. So in his situation, what we could have done was put one pad here, taken this pad here and put it on the inside over here, and then taken the other channel, put that pad right here, and then cross it over. So I'm going to show you that pad placement in just a second. So this is a great pad placement for lateral epicondylitis, tennis elbow, and we're going to go ahead and start that. And I just hit the power button, and again, you're not going to see this. You're not going to see my arm contracting. We don't want that with the TENS unit. Okay, and again, all the pulse rate, pulse width, our cheat sheet, so to speak, we're going to leave that in the description. Now let me show you a pad placement for someone with just general elbow pain throughout the elbow, the outside and the inside. Okay, so we're going to go ahead and hook up these other 2 electrodes to the second channel and save this little plastic piece so you can put them back on there when you're done and reuse these. Okay, so now you'll see I'm going to change this pad placement. So now I have lateral epicondylitis and medial epicondylitis, called tennis elbow and golfer's elbow. So I'm going to change it up a little bit and I'm going to crisscross. Okay, so the current now, this is channel 1. It's going to go from here to here. Now we're going to take this channel and cross it over, right? So we then take this here and that right there. Okay, and that's how we would do a larger area. We would do the same thing for the knee. So if you hurt your knee, you would crisscross them like this. The knee is a bigger joint. But if it's just your IT band on the side of your leg, you just put it right there, about a hand width apart, right on the, and put the painful area right in between the 2 pads, okay? If it's your back, if it's just a small local area on one side, you could get away with using 2 electrodes, again, with the pain right in between where that painful spot is. If it's just general back pain throughout the back, both sides, then you're going to want to use the crisscross pattern that we just used here. I hope that's helpful for you. I hope this helps understand how TENS units work. And if you have any questions or comments, feel free to comment below. I hope you like this video. Give us a thumbs up and make sure you subscribe because we're putting out at least 2 or 3 videos a week. Thank you. Thanks for tuning in. See you soon.